Today, we are going to talk about how to tell if your sleep habits are killing you. And, you added into the title there, is your metabolism working against you? Which I think is just so, such a great aspect of the title, because I have learned and you have learned how critically important sleep is, and people just don't recognize this. As a cardiologist, I'll just say that the people, my patients that comment that they don't sleep well is one of the most common things I hear from people. And for years as a physician, I thought, well, okay, duly noted, probably it's your health problems, your worries about your health problems that is leading to sleep problems. But now, as I've learned more about physiology, about fixing metabolism, I'm realizing that it's completely different than that. That actually there's probably more the other way around. It's not you can ask that chicken or egg question, but I think more commonly it's sleep problems that are leading to those health concerns that are so prominent in a cardiologist's office. And the sleep is just so common, really, that I'm glad when somebody's sleeping well, because it kind of checks that off the list. But the experience is most of the people that we're seeing that are saying, hey, I need some expert guidance on getting meeting my health goals, meeting my weight goals, meeting my longevity goals, how often sleep is going to be a really important factor for them achieving their goals. And in fact, I'm going to go a step forward and just state this a little bit more strongly, is that if you aren't sleeping well and you're struggling with losing weight or lowering your blood pressure or improving your blood sugars or improving your cholesterol, you aren't going to fix those problems likely until you fix your sleep. Like, the sleep is setting your metabolism, the lack of sleep, the inadequate sleep is setting up your metabolism to not allow you to fix those problems. And I think that's a really important point for people to understand, because nobody is out there saying, oh, I don't think sleep's important at all to health. Like, it's just not that big a deal. Everybody knows it's important, but I think what's under-recognized is how critically important it is. It's no surprise to anybody that lack of sleep leads to us not feeling well. We have all had that sleepless night, and the next day we feel irritable. We're not thinking as clearly. Our memory's not as good. We have, good evidence that lack of sleep also increases the likelihood that your job performance isn't going to be as good. And it also increases car accidents. But I think what's been under-recognized until more recent years is how impactful that lack of sleep, particularly if it's chronically over time, is on our risk for high blood pressure, for diabetes, for obesity, atrial fibrillation, heart disease, stroke, and even early death. And so, I thought this was kind of interesting. We put together some of the numbers of what happens when you are chronically not sleeping well enough. And there's research evidence out there that those people that aren't sleeping well have 4 times more viral infections, cold. So I think, again, not surprised that lack of sleep leads to a decrease in our immunity. People that are chronically sleep deprived, 4 to 5 times increase in anxiety and depression. There's an increase in blood pressure in those who aren't sleeping well, a 250% increase in diabetes, 45% increase in heart attacks, 750% increase in unhealthy weight, and a 15% higher risk of death. And I think that numbers like this help bring home to people, like, sleep is not just something that's optional. It's as important to our health and to our metabolism as not smoking, as being regular with our physical activity, as our nutrition program. And I think that that's really under recognized. So it's something that it's sometimes hard for people, our clients, to grasp when we say, okay, we know you're very excited about getting your health back on track, and you're very ambitious, and you're, kind of picturing yourself like working out and, eating healthy and all these things. And we're saying, how about just go to bed earlier? Like,
Yeah.
let's start with that. And you're like, well, wait, that's not enough. Like, how is that going to work? But I think science is, increasingly showing us the mechanisms for what I have recognized. And I think so many other people have recognized as well. And I love the phrase you used there, where you just felt uncomfortable. It's like you're grasping, right? Like you're seeking. That's the way I feel when I'm sleep deprived. Like I'm just like, I'm uncomfortable, and I'm looking for that comfort. And I tend to gravitate towards things that I know aren't best for my health to find that comfort, whether that's comfort food or just laying around on the couch watching, Netflix or whatever that is. And, now we're starting to see that it's our hormones that are guiding those decisions. Even with our best of intentions, we have, evidence that when you're sleep deprived, that this drives up the appetite stimulating hormone ghrelin. So, I've had this experience where I don't sleep at night, and then the next day I just can't seem to, I'm always hungry. Like, I want to eat, and that's because my hormones are set up that way. Or it decreases leptin, which is that hormone that tells us when we're full. And it'll stop you from, eating so much. So you can imagine when you have this situation where your cortisol and insulin levels are high because you're stressed, because you didn't sleep well. Your insulin levels are high, which is shoving energy into your fat cells. And because of your ghrelin and your leptin, you're just sitting there eating comfort food and eating way too much of it. How this is so commonly associated with unhealthy weight. I mean, as we said, a 750% increase in obesity in those people who are chronically sleep deprived. I think the science is starting to explain to us what we're, have learned on a practical level with our clients. Yeah, absolutely. And it reminds me of my patient that really taught me all this. It was years ago.
I love this story. I love this story.
I do. Well, and her name, this patient of mine, I'm going to call her Virginia. One of the most lovely people I've ever met. She was, I don't know, she might have been like 4'9". Like, she was, a little petite thing, but and just full of life. Like, she was just so cute with everything that she, did. But she really was struggling. Like, I got to see her as a cardiologist when I was at Mayo, because her blood pressure was just out of control. Like, she was on 5 different blood pressure medications, and her blood pressure, like, she's calling me multiple times a week saying, my blood pressure is 190 over 110. And I'm like, I don't know what to do about this. Like, I was sending her to the kidney specialist, and, we're doing all these things. And the other thing that she'd always struggled with was her weight. She was, she said 40 or 50 pounds overweight. That's probably pretty accurate. And on such a small statured person, then that was really a significant amount of weight. And she, she knew, she was always beating herself up about, I need to eat better. I need to exercise more. I know what I need to do. I just need to do it. But she just wasn't making any progress. And this was, earlier in my career. Like, today, I would have recognized the underlying problem right away. But at this point, maybe 12, 15 years ago, sleep apnea was known, but it, as a driver of high blood pressure, it wasn't as clearly recognized as that. But I'd read something about sleep apnea and resistant hypertension. That's the medical term for people that have high blood pressure despite 3 or more medicines. So I asked her about snoring, and it was kind of a comical thing, because her husband's like, I can't get any sleep. Like, she snores so loud. Anyways, the upshot of all this, and what was just totally cool, is that I sent her to a sleep specialist, and all of a sudden she's not calling me about her blood pressure anymore. And I'm almost like a little worried. Like, it was one of those double-edged things. Like, okay, I'm not hearing from her, which is good, but I'm not hearing from her, which I don't know, maybe that's not so good. And anyways, we finally ended up connecting, and she had lost about 40 pounds in about 6 months. I mean, this is a woman who was, in her 70s. Like, she'd tried to lose weight her entire life and had not been able to do that. And all of a sudden, it just, like, the weight's coming off of her, like, it just as easy as it could be. And she felt great. And her reason she wasn't calling me is because her blood pressure was great as well. And in fact, she had been taken off almost all of her medicines except for one by her primary care doctor. And what it was, like, what the whole fix for her was that she had severe sleep apnea. When that got treated, she started feeling better in the mornings and better the next day. She had energy, so she started moving more. That gave her more willpower and more ambition and more motivation to change her eating habits. And what I recognize now is it changed her metabolism. It changed her hunger hormones. It changed her insulin and cortisol levels, so that her physiology or metabolism was set up to burn fat rather than to store fat. And she just kept building on that over time. And ultimately, as I said, she lost 40 pounds, and she was on one blood pressure medication. One thing I haven't mentioned in all of this is that ultimately she didn't need the treatment for her sleep apnea anymore either, because she lost the weight, and that cured her sleep apnea as well.
Oh,
So
wow.
it really was instructive for me as a physician how powerful sleep can be for people that are trying to change their health, their weight, and want to live a long, vital life.
Yeah, it's the perfect example of the snowball effect. Like, you
Yes.
change one thing and it's just this cascading, you know, sequence of events that's towards that positive outcome. And in the end, it's like ties it all together. Like, she doesn't have to wear a CPAP anymore or do whatever treatment that she had to do in the first place to get that other stuff to happen. So sometimes it's just pinpointing, what the culprit is and what the root cause is. And that's why we talk about that so much with the 10 essentials and finding that root cause of what's screwing up your metabolism. So I just think that is like the quintessential example of finding a root cause and tackling it.
Absolutely. She beat herself up with, calories in, calories out. I need to eat less and move more, story for so long that, she felt like there was no way, like that was the only solution she was being offered. Hey, I want to
Right.
lose weight. Oh, well, you need to eat less and move more. And she tried and tried and tried and tried and tried, and she just couldn't do it. So what's the default there? We blame ourselves, right? Like, oh, well, I just don't have the willpower. I'm just not able to do that. Untrue, just so untrue. I mean, we have seen this over and over. People who are so wildly successful in their life because they're resilient, they're smart, they work hard, they are willing to sacrifice for the long-term good. They bring amazing things to the world, but their metabolism is set up to make them fail, and they're just not able to overcome that. It's something that we see all the time, and it's like they keep butting their head against this wall, and the only solution they're being offered is butt harder, like keep running into the wall harder. And it ends up costing them when actually the solution. And how often do we hear this from our clients, Rylan, when we get them a clear path, when they get the right root causes treated, how often do we hear people say, I'm losing weight, or my blood pressure is lower, or I'm achieving whatever the goal is that they're after, and they're like, it's not even hard. Like, it's not even, it doesn't even seem like I'm trying that hard to do it. And it's because their efforts are synergistic now rather than against what their physiology and their metabolism is.
Their metabolism's working for them now.
Yep. Exactly.
Not against them, working how it's supposed to.
Right.
There's so many And it's nobody's fault. There's so many things of this world that are hindering us from getting our metabolism to work. Like, but the default is to have your metabolism work against you in this world right now. And we just have to be aware of them and figure out what we need in order to overcome that challenge
Absolutely.
that we're all facing.
And anybody out there that is, struggling with these same issues or has had success, like they figured this out, that, okay, it's not all about, eating cardboard and tofu and, exercising 6 hours a day. It was, something much more simple and something that was more personalized to me. Like we talk about our precision approach, like we use a precision approach. And what I mean by that is that it's the right intervention for the right person at the right time. That is what makes it all come together. Like we can read all the general information out there about our superfoods and, the supplements and the importance of sleep or whatever. But if it's not the right fit for you at the right time, then it's just information. It's not going to change things.
Yeah. Yeah. So did you say you had some tools for like how people can determine if
Yeah,
they
you're jumping ahead now, Rylan.
Oh, okay.
Yeah,
I'm
that's
sorry.
next. Well, actually not next week. It's going to be the week after that. We're going to talk about the tools to fix your sleep, to fix your metabolism. But today I want to end with the things that we started with, was how to tell if your sleep habits are killing you. And there's 3 questions that you should ask if you're right there saying, or right now saying, okay, maybe my sleep is a problem for me. Maybe it is costing me my health. Maybe it is, what's holding me back from achieving my health, my weight, my longevity goals. Well, here's 3 questions to answer to help tell if that is the case for you. So question number 1 is, do you have a chronic illness or any signs of an unhealthy metabolism? So, the common chronic illnesses would be like heart disease, maybe you're a cancer survivor, anxiety disorder, depression, chronic pain, those kind of factors. If you have any of those, then I think you need to perk your ears up and say, maybe is sleep part of this? Or if you have signs of an unhealthy metabolism, which we talk about the 4 signs of unhealthy metabolism all the time: high blood pressure, unhealthy cholesterol, high blood sugars, or unhealthy weight. Those 4 factors, people in the United States have at least one of those 88% of the time. 88% of adults have at least one sign of an unhealthy metabolism. If you have any of those, and I think looking at your sleep more closely is an important thing. So that takes us to question number 2, which is, do you sleep 7 to 9 hours per day? More than half of us get less than 7 hours a day. I will fully admit I was one of them until I recognized how important sleep was to my health. And while we said earlier, not everyone needs 7 hours, but the far and away more commonly when people aren't getting 7 hours, they're fooling themselves into thinking that they're fine on less than 7 hours, when in fact that's a pretty rare thing. Like maybe 1 to 2% of the population needs less than 7 hours. But just be careful you're not telling yourself that false story. And the way to do that is, again, are you feeling well rested during the day? Do you have great energy? Is your health where you want it to be? Is your weight where you want it to be? Those are the important questions to tell if your sleep is there. And then, the questions about, do you, feel well rested when you wake up? Do you feel tired and sleepy during the day? Another question I like to ask people is, do you need an alarm clock to get up most of the time? Because if you need an alarm clock to get up most of the time, that may be a sign that you're just not getting enough adequate and quality sleep. So, sleep, again, one of the most important things that we address with our clients. It's the thing foundationally, I'd say, along with stress as well, that they just don't recognize how important that is in their health. And if you're somebody that is recognizing that you're not achieving your health and weight goals, that you have longevity goals that you're concerned about, and you would like any, some expert guidance on how to do it, then we would love to talk to you and help you in any way that we can. Rylan, how do we help people? How do people connect with us?
Yeah, so go to healthspanmd.com/talk, and you can schedule a call with me, your future health coach, and we'll talk about, what's going on in your life, what's struggling, what's holding you back. Point out maybe some of those things that, oh, I didn't even realize that, just get to the bottom of the whole picture and get to the bottom of what's going on, and see how, Dr. Hurst and I can help you reshape your health and longevity strategy. So healthspanmd.com/talk, TALK, obviously. healthspanmd.com/talk. And then Dr. Hurst, there were a couple questions.
Please.
Do you have some time? Okay, cool. So this one I'm actually really curious about myself. How many, oh no, not that. We already addressed that. Is napping considered a good way to catch up on lack of sleep?
Yeah, so napping is really individual, when you look at populations of people, it seems like a nap of like 15 or 20 minutes isn't something that takes away from quality sleep. But the guide I would give people is that if your sleep isn't a good quality and you're napping, the napping may be part of the problem. And there's multiple factors here. Like that's often what we do with our clients is that we have to say, okay, well, could it be this? Could it be this? Like we have to work through this kind of algorithm to figure out what's the thing that's holding them back from adequate sleep. But naps can be part of that. The physiology of this is that our brains are building up this substance called adenosine throughout the day that is like kind of our driver of sleep. And when we take naps, we lower that adenosine level so that when we're ready for sleep at night, usually, then we may not be able to get it because our adenosine levels haven't built up to a level that is needed. So, a short story, if you nap and you feel well rested and you're getting good quality sleep, then good for you. But if you're struggling with your sleep at night and you're napping, you have to consider that may be a contributor to it.
Yeah, I think there's an art to napping. There's almost like napping for like 3 hours a day, like 2 to 3 hours a day. I feel like that's like, okay, you were sleep deprived and you needed
absolutely.
that sleep. Napping for 10, 15, 20 minutes, I think it's a good thing. You're not getting into that deep sleep yet, but you're kind of refreshing, and you'll wake up feeling more rested. You're kind of refreshing your mind and what's going on. Like Thomas Edison, for example, I know he took like 3 15-minute naps a day, and he was an inventor and he was creative, and that's how he channeled his creativity. So I really do think there's an art to it, and a way to actually increase your time. My dad says he invests 15 minutes in a nap sometimes.
Yeah,
because
absolutely.
if you try to power through it, sometimes it's like, I need to refocus. You're never gonna get reset and focused. And so I think sometimes that's necessary. And then what would you say to someone who is being treated for sleep apnea and is getting adequate hours of sleep, but still not feeling rested throughout the day? Would you say that there's another underlying issue going on, or something needs to change with sleep?
Yeah, absolutely. So, I think that that's a challenging topic. And I think that's one of the things that we bring value to our clients is they're, as a physician, not feeling, with a lot of energy, you're feeling fatigued, you're feeling tired, like really common symptom, but it's hard to pinpoint because there's so many factors that could be contributing to that. And so the way I approach this is, okay, let's fix the things that we know are an issue, and then kind of reassess and see where things are. So, I need to know so much more about somebody to answer that. Like, what are they eating? What is their physical
Mm-hmm.
activity? How much stress are they having? All of those things. And then there are nuances to sleep, like just time in bed isn't the best measure of the quality of your sleep. We're increasingly recognizing that there's a structure to sleep that is both has individual variation, but also there's kind of principles in there that are important, like getting adequate REM sleep and adequate deep sleep. And, for some of our clients to really dig deep into sleep is one of the things that they need to do. And we assist them with. We, have used devices like the Aura Ring to get more data about people's sleep to help guide them on that. I'll just give an example for one of our clients. It was kind of that similar story. I'm in bed. I feel like I'm sleeping well, but I just don't feel rested throughout the day. The Aura Ring pointed out to them that the days when they were drinking alcohol, even though it was a couple of glasses of wine, like closer to bedtime, that just really disrupted their sleep patterns and led to them not feeling good the next day. And so that was their intervention, like getting that extra data help them say, okay, 1 glass of wine's fine, 2 glasses of wine is going to affect my sleep. Even though I feel like I'm sleeping well, I can tell from this data that I'm not. So complex question that's really individual, but it's more than just being in bed and having the CPAP on your face.
Yeah. Good answer.
Yeah. Well, good question. I'm even more impressed with the question.
One more.
Next week, go ahead.
Oh, sorry. Can I ask you
one more?
So
absolutely.
This is kind of from just observation of what some people have been mentioning and my own, but how do you feel as a physician? Because this isn't very factual. This might be like a little woo-woo, but like if you go to bed believing that you're terrible at sleeping and that you can't sleep without some sort of supplement, or, you're just labeling yourself as a terrible sleeper, it's impossible for me, nobody can help me kind of belief, what would you tell someone who's going through that? Or, what would you advise someone who's tried everything?
That's a huge issue. It's a common issue, and one that there is a proven therapy for, and I would absolutely say those people need to see a psychologist usually, but an expert in cognitive behavioral therapy for sleep. That's the number one. That's a first step, according to the experts on people with chronic insomnia, is to see a sleep expert for cognitive behavioral therapy. I've had this myself because sleep has never been something I've been great at. And it was eye-opening for me. So, and that's a big part of that CBT for any condition, but it's changing those false beliefs. So really good question and really important topic. We'll have on our podcast in the future a CBT specialist to talk about that in more detail, because I think it's a really common problem. People are suffering needlessly when there's an effective therapy out there that can help them tremendously. So next week's a really exciting week, Rylan. We're not going to be doing a Facebook Live next week, right?
No, we will be doing a webinar. So I'll be sure to post the links next week. So be looking forward to that in the Facebook group about the upcoming webinar that we're going to do that you can register for.
Yes. So the science of longevity, the 10 essentials to living a long and vital life. So we're going to talk about this, the sleep's going to be part of this, but we're going to talk about the 10 essentials. One of them is sleep. There's 9 others that are very impactful in helping people achieve their health, their weight, their longevity goals. And we'll also talk about how fixing these 10 things or addressing these 10 things can lower the risk of heart disease by 80%, stroke by 50%, cancer, dementia by about 1/3, how just absolutely critical these are. And these are not things that are usually talked about in doctors' offices, or at least addressed effectively in doctors' offices. So if you are, have any health concerns, if you have high blood pressure, cholesterol, blood sugars, your unhealthy weight, or you've had heart disease, or you're a cancer survivor, or you're worried about these things, you want to live a long, give yourself the best chance to live a long and vital life, join our webinar, our workshop next week. We'd love to share our information with you, and I'm excited about that.
Yeah, I posted the link in the comments so you guys can register. It doesn't look like it showed up. You can register here. It's healthspanmd.com/workshop. But I'll try to post it in the link in the comments there too.
Beautiful. All right, I end with my favorite sleep quote, Rylan, from
Yes.
William Shakespeare, like the great bard himself. I don't know, I came across this somewhere, and I'm like, it's amazing to me what William Shakespeare knew in 1600, 70 or whatever it was when he was alive. But
Yeah.
the insights he had into human behavior, like I don't know. There's a reason why still, almost 500 years later, we're talking about William Shakespeare. But he said of sleep, and I just love this, is sleep that knits up the raveled sleeve of care, balm of hurt minds, great nature's second course, chief nourisher in life's feast. I don't know how you could say it any better than that.
Yeah, absolutely. It's so metaphorical but real at the same time, like so descriptive. I love it.
Absolutely. All right, great. Well, thank you, Rylan, for your time. Thank you, everybody, for joining us. If you have any further questions, just leave them in the comment section. We'll get back to you about that. And if you're interested in what we could potentially do for you, jump on a strategy consultation with us. We'll take a few minutes of your time, get clear on what the issue is, and then if we can help you, we'll be glad to do so. But until next week, everybody have a great week.
Take care.
Bye-bye. This information is for educational purposes only and is not medical advice. Don't make any decisions about your medical treatment without first talking to your doctor. Thanks for watching, and if you want to learn more about living a long, healthy life you love, click the link below to learn more about how we help people increase their health span. And if you like this video, hit the like button below, share it with your friends, and be sure to hit the bell and subscribe.